Hi, everyone, and welcome to the Florida Horticulture for Health Network's webinar on communicating respect for people with diverse abilities in a therapeutic setting. We're really fortunate to have the Nova Scotia Horticulture for Health Network co-hosting this event and webinar. My name's Sarah Sterling, and on behalf of both Horticulture for Health Networks, I'm really pleased to welcome you to this great webinar. I have been part of the Florida Horticulture for Health Network for several years. I'm really pleased to be welcoming our host, Nanette Moss. Please note that the Florida Horticulture for Health Network uses several platforms to share information and education. They have been listed on the slide. You can also follow us on Facebook or find us online. We send monthly e-blasts to subscribers about upcoming webinars such as this one, and including recent YouTube videos, horticulture information, a whole bunch of other interesting events related to how horticulture can positively impact health. Today, I'm really pleased to introduce Nanette Moss. She's an activity assistant and healthcare worker with 13 years of experience working in complex care. Nanette plans and facilitates therapeutic programs for people with a range of cognitive and physical differences, bringing a compassionate, lighthearted approach. As an interdisciplinary artist and writer, she explores and uses the symbolism of plants. Nanette integrates art, plants, and health in her professional programs and creative projects. After experiencing severe hearing loss in her late 20s, Nanette had to adapt to living with a permanent disability. She utilizes her art platform to support understanding across perceived boundaries through personal reflection and conversations with creatives of diverse abilities. Sharing ideas and information increases our potential for growth, both individually and in community. Nanette's intention is to utilize facilitation, speaking, and creative expression to promote self-acceptance and authentic connection, cultivating a joyful life with nature as a unifying medium. I'm so excited for this webinar and very, very honored to present and to introduce Nanette Moss. Take it away.
Thank you so much for the introduction, Sarah. Welcome, everybody. Thank you for taking the time to join me today. Communicating respect for people with diverse abilities in a therapeutic setting. I'm Nanette Moss. Today, we are going to build a bit of a toolkit that we can pull from to personalize our interactions with diverse individuals. I want to mention that we are going to have an overview of many different situations. Of course, we can't place people in boxes and we can't cover everything in detail today, but we'll get a good overview and it'll be very practical for us moving forward. I'd like to start with the land acknowledgement. I live, work, and play on the traditional unceded territories of the Nanaimo First Nations in what is now known as Nanaimo. I will do my best to walk with humility as I learn from these beautiful lands, understanding that I am here as a settler. The objectives for today are to build trust and engagement by adjusting our communication styles for populations with diverse abilities. We'll become more aware of interpreting other people's facial expressions as well as our own. We'll get to interpret body language and become more aware of the body language that we are communicating with. We're going to keep ourselves safe and grounded, including using de-escalation techniques for violence prevention. One of the ways that we communicate is through the environment we create, and it's very important that we make everyone feel welcome. And part of the way we do that is by understanding what they're going through, how they experience the world, so that we can make them feel more safe. First, a word about disability. Um, I grew up with a father who had a hearing impairment and I had to help him on the phone. He now has cochlear ear implants. And then when I was in my late 20s, I had severe hearing loss, and it was a truly humbling experience. Sometimes people would treat you like you're stupid or become very impatient with you, and it really helped me become more understanding and compassionate of other people. Let's see now. So for folks, I want to mention though that myself and folks that I interview on my website who have diverse abilities, none of us consider ourselves disabled. It's more like uh, society has things stacked in such a way that we have to come up with creative workarounds. And so we wouldn't be labeled, we wouldn't consider ourselves being labeled as disabled. Sometimes it's very frustrating to try to adjust your behavior for folks who are disabled or have diverse abilities, but I want to remind everyone that it is 10,000 times more frustrating for the person with that difference because they have to deal with it every moment of every day. So please remember to try to have some compassion and respect our resilience. Now, some of the ways that we can assist without patronizing is I'm going to back up a little bit here. First, I want to say that sometimes we're afraid to reach out across boundaries because we're afraid of offending the other person. And so we don't reach out at all. And I really want to encourage people to try to change that. Uh, be willing to maybe make a mistake, but
Nanette, I just need to pause you for a second because I think you've accidentally muted yourself.
oh my goodness, I was
That
Right after,
gesturing.
just after you said it's okay to make a mistake.
that was me. I
Okay.
apologize. I see one of the participants is not muted, so I apologize.
Okay, so I encourage everyone to don't worry so much about making mistakes. Come into a situation with compassion and truly seeking to understand the other person and their perspective and experience. That will go a long way. Uh, so, how can we do this? We can try to be observant and anticipate their potential challenges. So, if you are getting the feeling someone's not understanding you, maybe talk slower, look at them, enunciate. If you see somebody in a grocery store in a wheelchair, they're trying to get something off a top shelf, you can say, "Can I get that for you?" So offering assistance without being patronizing can be very simple. It doesn't have to be intense. We can have a little sense of humor if we need to. Just accept things as they are and not make a huge deal out of it. You know, do offer. Ask if they want assistance. Some people are fine on their own. Remember, like they've gone through this whole life without our help. They're fine. They don't need our help, but a little a little assistance for our community members is welcome, right? So if you're working in a therapeutic setting and you see a client or a patient for the first time, how might we get an idea of what their needs are so we can better assist them? If you see someone sitting at a table, you might look for clues about their mobility. Are they using a walker? Are they in a wheelchair? If they're in a wheelchair, do they have foot supports? That will help us know whether they can't have strong enough legs to wheel themselves along, or whether they have weaker lower body strength. And again, if they're in that wheelchair, if you see signs of a sling behind them, sling straps, that gives you really good clues that they are transferred with an overhead lift. They may also have weaker body strength as well. They definitely should not be standing if they have that sling. And then if they have a great big wheelchair called a Broda that reclines, a big reclining wheelchair, they're not even able to wheel themselves along. Again, clue to mobility. And also you can see what are they doing? Say they're sitting at a table. Are they feeding themselves? Do they have small manual dexterity using a knife and a fork? Finger foods, holding a cup? Um, are they um, Okay, let's continue on. What's their level of independence? Does it seem like they can feed themselves, for example? Are they reading a book? Are they just doing what appear to be meaningless movements like squishing a napkin, picking up their clothing? Are they aware of their environment? So if you walk by, do they track you at all with their eyes? Do they watch you? Do they respond to sounds going on around them? Are they engaged in an activity, like I said, with a book? Are they chatting with someone? Are they watching TV? And if the TV is on, are they actually watching or are they just sleeping? Are they staring off into space? So are they making verbalizations or meaningful or meaningless movements? So by verbalizations, I mean, are they either saying words, just calling out? Are they making sounds that are not words? Are they just kind of twitching or picking, or are they making movements that seem to have a purpose? These are all going to be clues. So scenario, say you see someone at a table and they are in a wheelchair. They have foot supports. They seem to have kind of jerky, twitchy movements. And when you get their attention, they just kind of stare. What might you think about this person? Now, you don't need to drop this in the chat. We're just going to keep this in mind because then by the end of the presentation, we can check in and see how much we learned and how you might handle approaching this person. All right. So when you're going into this first interaction, though, first thing I want you to do is check yourself. If we come in with our huge task list and we're in a big hurry, rush, 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 talking fast, we want a result fast, it's likely that this person might be resistant. They might be a little agitated. At the very least, they might not be able to follow the train of what you're saying. So first thing, check yourself. Act as if you have all the time in the world. Everything's fine. You are just right here in this moment. Take a breath and be really interested in what they have to say. I suggest framing your approach with the 5 domains of health. Check in on their physical condition, how cognitively aware they are. For example, if you say, "Good morning, my name's Nanette. What's your name?" Do they respond appropriately? What's their emotional state? Do they seem anxious, distracted, angry? Do they seem open? Give you back a smile if you smile at them. And by spiritual, what I mean here is their sense of belonging or greater purpose. And while you might not be able to assess that in the first conversation, this is something we want to keep in mind because, of course, we want to build a sense of belonging and purpose in our programs. So the social aspect would be, are they sitting by themselves? Are they sitting with others? Do they seem interested in interacting with you? So some strategies you could use for this person specifically, any new person that you're approaching, could be slowly enter their field of vision calmly at a distance, make eye contact and smile, greet them with minimal words and speak slowly. Start out with a positive statement such as, "Wow, that coffee smells good," or compliment them. "That blue sweater looks so great on you." You can ask simple questions to assess their awareness, such as, "Good morning, what's your name?" You can invite them to your fabulous program if it seems like they are responding appropriately and interested. And do reassure them as needed. So sometimes people will think, they'll feel nervous about joining a program because they think, "Oh, I can't hear well, I can't see well, I don't know anyone, I'm not any good at gardening." And I encourage you to reassure them as needed, such as, "You don't have to have any special skills. I'll be right there with you. And if you decide it's not for you, I can take you out. No problem." That can help a lot. Make sure you stick to your word too, of course. We're looking to build up trust over time. So hearing impairment, of course, I have a lot of personal experience and thoughts on this because of my own hearing loss. First thought is that I like to address is that the difference between deaf with a capital D, a lowercase d, or hearing impaired. So deaf with a capital D would be folks who have basically no hearing. Hearing aids will not help them. They may use sign language. Whereas deaf with a lowercase d is, in my case, I'm deaf with a lowercase d. I do use hearing aids, but it would be extremely difficult to function without them in my job, for example. I'm not very good at lip reading yet. I need to practice. So hearing impaired, what's the difference with hearing impaired? So hearing impairment, they may or may not wear hearing aids. They have some difficulty. They might be in a stage of denial. Sometimes this will, sometimes this will express itself as anger or lashing out at you, like, oh, I don't want to go to that program anyway. It's too noisy or people talk too fast. And just look at that, those kinds of statements as clues. Perhaps there's another issue going on. Maybe it's hearing, um, maybe there's another discomfort that you can address. Alrighty, so when we have hearing loss, we do have increased dependence on other senses, such as visual cues, tactile. Interestingly, as I lost my hearing, I became more sensitive to vibration, which was unexpected for me. Um, and then, yeah, so keeping keeping in mind the dependence on visual, you want to be really aware of coming into their field of vision when you want to say something to them. We're going to go on to the next slide with more strategies in a moment. But first, I want to give you examples of how not to connect with someone. So if someone is hard of hearing, here's what not to do. What, are you deaf? Never mind. I said, or I said, or so exaggeration and doing anything that makes somebody feel teased or made fun of or less than. Not only is it, cruel and rude, but it will make them quite angry and it will make them not trust you. You will not be seen as an ally. So let's try these strategies instead. So we're going to enter their field of vision. We're going to speak slowly, clearly, maybe a little bit louder, but you don't need to yell. And sometimes I find that slightly lowering a voice might make it a little bit easier to hear. So lowering the pitch a little bit, raising your voice a little bit, enunciating, and saying a few words at a time is so helpful. So rather than say a very long paragraph, maybe say half a sentence, pause, see if they understood that much. Say the next few words, see if they got that much, and then build on it. If they are not understanding your words, like say the word sleep, say someone's not getting the word sleep and they're mishearing you, use that word in a different sentence, like sleep, like you go to bed and go to sleep, or change the word so it uses different letters and different sounds that perhaps they'll have less trouble with. Let's see now. Use gestures and facial expressions. That really helps. So you can say, as a carrier, you have to wash people a lot. So you might say, have a wash or have a wash. Do a little gesture to help them understand. Facial expressions. So if you if you are open and a little bit more theatrical, it can help. Act it out. Don't be afraid to act it out. This also works great with people whose first language is not English. And write it down. That's a nice simple one. So visual impairment. Total blindness is rare. It's a misunderstanding that people who are legally blind can't see anything. Often they'll see light, shapes, and color. And like with the hearing loss, you might see development of other senses. So they might have really good hearing. They might have the sense that someone's behind or around them. Some people develop a really great sense of smell and they recognize you by your smell. It's important to keep in mind everything has its place. So don't go in and rearrange their room because they have things in a place so that they can be as independent as possible. With hazard prevention, along with keeping everything in its place, we want to keep in mind not creating a trip hazard or, for example, leaving a cupboard door open or leaving a bathroom door open part way so that they might run into it. You want to either have things all the way open or all the way closed. So some strategies we can utilize are not rearranging belongings without asking. We can avoid startling them with sudden speech or noise. We can also alert them to hazards such as we're coming to a door here, or watch the corner of this counter, or lift your feet up. We're coming to a mat. You don't want to trip on the edges. You can guide their hands with permission. For example, you can say in a program, I have this wonderful soft lamb's ear leaf. May I put it in your hands? Or may I hand you a trowel? And then guide their hands. Always explain what you're doing. Don't just grab their hands and do something. And don't just grab their wheelchair and move them somewhere. You want to let them know what's going on and get permission. Again, like with visual impairment, it can be really frustrating for if others come in and assume that they don't have opinions and they aren't capable of doing things on their own. Always try to encourage as much independence as you can and show respect for that. So when you're walking, a common protocol is instead of holding hands, which can feel a little bit demeaning to some people, common protocol will be put their hand on the crook of your elbow while you're walking, and you'll alert them as you go. For example, oh, we're coming to a curb, or we're coming to a step. Let's pause, take a little step down. Or warn them if something noisy is about to go by, so they aren't alarmed and they understand what's happening. So if someone is both visually and hearing impaired, it can be more challenging. Um, Often I will find that using touch, the sense of touch becomes more important as you approach. You would want to do so gently, like announce your presence, as it were, by gently touching their shoulder, for example, not like tickling their toes and not coming in really fast, shaking their shoulder. Don't do anything sudden. First, let them know you're there, a little reassuring touch. Often these folks might respond well to a little hand holding. So what about nonverbal people who aren't able to express themselves, possibly due to a stroke or an aneurysm? Um, what we're going to want to watch for are clues to what they want. First thing is assume that nonverbal people can understand you. That's number one. Don't assume that they are just uh, laying there, just bodies, just shells. They are living people with opinions. So some strategies are look for the tiniest little movements. So look for a tilt of their head, which could be the slightest little yes or no answer. Watch for eye movements. For example, if you hold up two choices, like which shirt do you want to wear, this one or this one, and look and see where their eyes go. And they'll look toward what they're interested in. I look for facial expressions, such as if something is interesting, they might have the slightest of slight smiles and open their eyes just a little bit wider. If something is a no, they'll often squint a little bit. There may be also attempts at verbalizations, so watch their mouths for tiny little beginnings of a like a yes, or putting their tongue on the roof of their mouth like a no. Do try to break things down to yes or no questions. If you have something complex you want to ask, do it in one step at a time. Now, if they're able to move their hand or their finger, then you can have a little whiteboard or a little chart that has yes, no, hungry, all the some common things that you might want to ask them, and they can just point to the answer. That's really helpful. So degenerative conditions, of course, we can't go into great detail, but just broadly speaking, degenerative conditions will be where you see a slow change over a long period of time, such as Parkinson's, where there might be stiffness and jerkiness in the movements, or a flat effect. So it might seem like you say, "Good morning, how are you?" "I'm fine, thank you, how are you?" There might be that flat effect, even though there's emotion behind it. So with multiple sclerosis, um, often it affects the body, may eventually affect the brain. Keep in mind these conditions are not linear. So even if we read descriptions, every step might not happen for everyone, and people will be at different stages. So use your toolbox to assess what someone's ability is, what their interests are, and go from there. But with MS, some folks have some mobility in their hands. It might be reduced, but I knew one woman who she typed her autobiography with her thumb. So there is a lot of ability still there. You want to tap it and figure out what they're able to do. They're going to have a lot of reduction though. So they might not be able to move their legs further along. They might not be able to lift their arms, but they could do something like maybe hold a paintbrush in their mouth and still paint. There are ways to engage. So with Alzheimer's, we're going to talk more about dementia later, but keep in mind Alzheimer's is the cause of 40% of dementias. With arthritis, we're going to want to be aware of their pain level. And when they're in pain, they'll be less likely to want to participate. So be kind, be thoughtful, be patient with them, needing to move slower. All of these things are going to have a big impact on their sense of self because pain detracts from enjoyment of life. They might be exhausted and they might be malnourished because it's physically harder to feed themselves. It might have difficulty swallowing. They might have brain fog. So we'll keep these things in mind. Some strategies are using our previous toolkits. We're going to want to be willing to listen and talk about hard realities. This is very important because if you're in a hurry and someone is talking about their frustration with life, or even had some people say that they were just waiting to die, try really hard not to just walk away. Sorry, bud, gotta go. I don't have time to talk right now. Try to listen carefully and acknowledge, oh, that's really frustrating. I totally understand how you feel that way. That's really frustrating. And also try to reaffirm their value at the same time. Like, you've worked really hard. You do your best. You just let me know however I can help. Um, do report if someone ever has suicidal ideation or is self-harming. Do report that to nursing staff so that that can be followed up on, whether that's through antidepressants or finding other ways to engage them and draw them out. And that's something you can really clue into. This person might need one-to-one. They might need a small group therapy. So be really willing to listen, and then that will build up trust so quickly. Maintain their dignity and never want to accidentally say something that sounds like a cut down or teasing them. Never laugh at someone's attempts. Every time they try, it takes courage to step out and be willing to make a mistake and maybe do something imperfectly and be made fun of. It's it's really frustrating. It's difficult, takes a lot of energy. So we want to praise their courage, praise them for trying. Do maintain boundaries too, because it's easy to get into a situation where if someone physically cannot move as much and they are dependent for some things, some people become quite overbearing and demanding and act like you're their personal servant. So you do need to have boundaries sometimes and make a graceful exit from the conversation. Like, I gotta go now. It was lovely talking with you. See you later. Or if, for example, you're having difficulty understanding what someone is saying, that is it's such a hard feeling and it's so disappointing when everything you try, you're just not able to communicate with someone, it's not getting through. Then you could say something like, I'm so sorry, I'm not understanding. You can either ask a staff member who knows them better for ideas what they might be saying, or say, I'm so sorry, I'm going to come back and try again later. I'm not catching that. Thank you so much for trying to communicate with me though. So with brain injury or stroke, an overview is just so we understand what they're going through. Often that'll affect one side of their body. So you want to be really careful. Say I had right-sided weakness. Um, I might be able to move it, but it might be extremely sensitive head to toe. So be very gentle with the affected side. Never pull on it. With brain injury, especially, there might be personality changes such as impulsivity. They might have increased difficulty with motor skills, mobilization, word finding, speaking, processing thoughts, putting things in a sequence or following a sequence, eating or drinking. So some strategies are we'll mix together our toolkits of the hearing and visually impaired and the nonverbal folks. We're going to increase our awareness of this individual, what they tend to like. Then we will be better able to anticipate and interpret their speech, acknowledge their frustration, anger, and sadness, and again, continue to affirm their value. So it's dementia. Dementia is such a huge subject. I'll try not to spend the next half hour talking about dementia, but very briefly, early, mid, and late stage. What I'm considering early, mid, and late stage are early stage would be getting forgetful, like, what time was it at again? Where are we going again? What's happening? And they really benefit from cues. So, yes, no answers. But so, say a conversation might be like, do you like gardening? Yes. If you ask, what did you grow? That's so open-ended. It kind of puts them on the spot and they might not be able to remember offhand. But if you give them cues like, did you grow veggies or flowers? Yeah, I grew veggies and flowers. What kind of veggies? Corn? Strawberries? Yeah, I grew those. And potatoes. Giving them little cues will help them. And it's tricky to say, what's your daughter's name? They may or may not remember. But if you say, do you have kids? They're more likely to remember. So give them cues, give them prompts. And so once you've established they used to garden, you can say, you sound like such a good gardener. Throw in a compliment, makes them feel good about themselves, and then invite them to your program. Would you like to go do some gardening with me? We're going out there right now. And as you're walking together, say, I'm so glad you're coming. Make them feel appreciated and valuable, like they're bringing something. So, mid stage, what I'm calling mid stage, would be somebody might be having more trouble with word sequencing, processing thoughts. So, speak slowly and simply simplify your sentences. And there might be more delusions, which can be quite tricky. They might have more inhibitions and misinterpret a situation. So, one example that worked really well for me, two quick examples. One was a woman who I would try to get permission to do her care, say, um, are you ready to have a wash? She'd say yes, but then she'd immediately forget we had the conversation and swap me away. What are you doing? And so what worked well for her was being a little bit more theatrical and saying, good morning. I'm so glad to see you. Let's put on this dress. That helped with her. Whereas another gentleman, that approach would definitely not work. He would see that as very babyish. And for him, what worked well was being very professional because he had a tendency toward aggression, being sexually inappropriate, misinterpreting the role of the staff. And so with him, I might say, good morning, sir, and how are you today? And are you ready to get dressed? And then physically be very aware of your body. So if you have, a scrub top or, a scoop neck top, if you're leaning toward them, it might be gappy. You want to avoid any kind of cues that might make them misinterpret your role and why you were there. So either kind of crouch rather than lean forward, or you might turn your body. So if they're here, you're slightly turned to the side. So if you have to lean forward, it's not right toward them. And to be aware of your body. But that worked really well with him being professional, but still having a bit of a sense of humor, and making sure, and when I say sense of humor, never directed toward them. Um, always, always give them dignity. If they need help with something, you could say, may I help you with those buttons? They're so small, aren't they? They're really tricky. Acknowledge that it's challenging. Don't necessarily come in and do things perfectly really fast. So later stage, what I'm considering later stage would be perhaps they've lost their use of language, really, and they're using word salad, it's jumbled. For them, it might be better, a lot more sensory, quiet, calm, soft touch. Music is wonderful. And humming, not a lot of chatter. Tell them what you're doing as you're doing it, but fewer words, more gentle sounds. Consider for everyone with dementia, consider every question as an opportunity to be an ally. So if they ask you something over and over again, think of it as they trust you enough to ask. How do I go to the dining room again? Where's the bathroom? That sort of thing. Uh, be willing to accept coexisting versions of reality. Use cueing, asking, and directing. So in this case, it might be like if someone has trouble processing the question, just say, it's time to go to lunch now. Let's go. We're going to the garden. Let's go. And if they want to come, they will then come. Don't drag them along. But if they want to come, that's implied consent in my mind. So assisting, insisting, and resisting, we hear this term meaning um, Well, basically, if you don't insist, they won't resist. Or if they resist, don't insist. Basically, this means the more you push someone who's resistant, the more likely they are to have an aggressive episode and be activated. We don't want that. So give people space to make their decisions. If you can tell someone's resistant, come back later, have someone else try to invite them. Consider yourself as part of their team. You're there to help them and support them. You're not there to, they're not a problem. And asking a million questions is not a problem. If they need help, it's not a problem. So developmental disabilities also is so widely varied. Um, Please just keep in mind, everyone is an individual. They have opinions, they have wants and likes and needs, and we want to get to know these individuals, what they need. So, broadly speaking, I would like to comment that so with Fragile X, for example, or Down syndrome, you might have multiple situations that they are living with every day. It might be mobility, it might be um, extreme food limitations on what they can eat, it might be trouble processing, it might be difficulty walking. There's a lot that they're dealing with, so try to be compassionate. With cerebral palsy, often there's physical difficulty, and they're totally mentally sharp upstairs and very capable. Do go in with that respect. So with the neurodivergent spectrum, you might see like someone with ADHD might be constantly looking for that dopamine and need the stimulation, whereas someone with autism might need a quieter environment because they are overwhelmed more easily. So keep in mind these different needs. ADHD would benefit from being able to walk around, to handle things, and someone who's autistic might need to focus on one thing at a time. One thing, what do they have in common? Okay, so sometimes it can be very helpful to have a structure, have guidelines, have boundaries. Like, this is the time that we do this, or we are doing this craft right now. It's not time to eat. Or if you don't want to join in this, give them an acceptable alternative, not and make it very clear what behavior is acceptable and what is not acceptable. So my first request, as I mentioned before, is do not underestimate them. Do not underestimate people with diverse abilities. We want to find where they excel. Some folks, maybe they present as less cognitively intact. They are so creative and able to really focus in on something. So you want to try to get to know that individual and find out what they're capable of. I want you to expand your definition of success. So instead of thinking we are going to all plant these beautiful flowers, they're going to be in equally spaced, and we're going to have three per pot. It may or may not look like that. It might be like someone is just having fun digging in the dirt. Someone might completely plant it sideways. Someone might pour a whole pack of flowers into one little pot. If they are enjoying themselves and no one's having a meltdown, it's fine. It's a success. You might have someone saying boring or just walking around the room and not participating at all or just sitting there staring. But you know what? Like they're there. They're experiencing it. They're experiencing the socialization. They're observing. So count it as a win. Like we mentioned, establish those cues, routines, and boundaries that will be very helpful. Be aware of sensory sensitivity, the sense of comparison, so with each other and also with you. So, like I mentioned, with folks with dementia, try to dial down your demonstrations, for example. So they are comparing themselves constantly to others, probably. If you go out in public and people stare at you and the world is not built for you, um, every day is a struggle and you're aware that you're different. And so try to dial things back, do things slowly, and they don't have to be perfect. So watch out for frustration and triggers. If you see someone's getting frustrated, I encourage them to take a deep breath, take a little break. But you can also show in this, I don't want to say redirection, in your reassurance, Show them that you believe in them. I saw one leader. She was so amazing. Somebody, we were learning to counting money, and someone was getting really frustrated and starting to cry. She knew her very well and knew that this response would work well with her. And she said, "You're going to take a deep breath, you're going to wipe your tears, and you're going to try again." And she did, and she was successful. Show them that you believe in their abilities. So one example, I'll just say this quickly because I'm a little bit behind where I want to be. But so you can connect through sensory objects. So it might be very comforting to have either something to squish, different textures to feel, have something available that they can contact and handle safely. You can adapt tasks to make them safer for people. Just consider their surroundings, the tools, the number of people you have, such as when I was at Claytree for my practicum as an activity assistant, I worked with some folks with some leaders in the kitchen. And it was amazing to see how tasks could be adapted. So everybody had something that they were in charge of that was appropriate. So maybe someone just stirs. That's what they do. They just stir. Somebody else, they load the dishwasher. Just find what you think somebody can handle. Give them that one task and let them rock that task and totally focus on doing that task 100%. Try calming them with cue phrases. Staff will often be very helpful in finding what is this person's cue phrase. Like if um, someone was inappropriate, then like sexually inappropriate, his phrase was home time. That was a reminder. You don't do that here. You do that at home. So try to find out what are people's cue phrases. So it's consistent. Consistency is very important. Facial expressions, again, with dementia and some folks with developmental disabilities, you want to be kind and be open. They can be very good at seeing your expression if you're angry, if you're frustrated. Be calm and be kind. Too cool for school. So this would be the person who says, "I'm not going there." They don't consider themselves the same as everybody else. So maybe at a facility, it's somebody who they don't join anything. Maybe they don't come out except for meals. And how can you get this person engaged? Uh, they want to be seen as independent, so uphold that. You could leave space for them on the perimeter, is what I suggest. Continue to invite them, even if they say no for a long time. They might come join eventually. Leave space for them on the perimeter. Ask that, like I said, and if they do come, don't say, "Hey, everybody, look who's here." Don't draw attention to them. Before you even get to that point, though, you might need to build up with little gestures. So, say you pass them in the hall. You wouldn't use the same approach as someone in mid-stage dementia who you're like, "Hi, how are you?" Don't do that. You might just do a little, just be cool, just be laid back. Nod at each other a few times, and then over time, they might get familiar with you. You might say, "Hey, you have an idea for a cool program?" And they might just laugh or scoff or say something totally inappropriate. And you could say, "I don't know if I can pull that off, but I'll see." Eventually, having a little sense of humor, respecting their independence, eventually you will build up a relationship with these folks. Alrighty, like we said, acknowledge with a nod, use a calm tone, keep inviting them, hold space on the periphery, and don't draw attention. So, depression or grief, I want to cover a couple of situations that aren't exactly considered diverse abilities, but I want to include them because they're mental states that really impact our ability to connect. It makes it harder to think. It makes it harder for us to physically carry out our daily tasks. So it's important to have things in mind for how we can make folks feel more comfortable. Also, because a lot of folks that you're going to be working with, say in hospital, long-term care, day programs, there may be a level of depression because of the very state that they are living in. Okay, so along with the depression, we want to be aware there's often fatigue, brain fog, difficulty making decisions, withdrawal or apathy, self-neglect. So be pleasant, not little mixed sunshine coming in. Tone it down just a little bit. Be pleasant, but not super happy. That might make them feel even more isolated. I would start with a one-to-one, have them build trust, get to know them. Try to ask them light questions at first, nothing that feels too prying or too heavy. Invite them along to things that are lighthearted, easy wins. Never force them. And then, of course, the physical comfort here. Keep them warm and hydrated because they might be neglecting themselves. So with anxiety, speak gently, interrupt their thought loops. If someone keeps spinning around on the same thing, like worried about this, worried about that, just interject with something. Hey, we can think about that later. Right now, come on down, try this. Let's take your mind off with a little music. Focus on the present through senses and tasks. So you're breaking the thought loop by giving them something to focus on, something to do with their hands, and what is in front of them right now. You can offer them a low sensory stimulation environment to start, such as going out into the garden, listening to the birds. Stay with them, or maybe have them sit right next to you during the program until they feel a little bit more secure. And always praise any efforts. Again, keep your promises with these folks. If you say you'll be back in 5 minutes, be back in 5 minutes. Excuse me. So with trauma, I would use a combination of tools, including the ones that we'd use for grief, depression, and anxiety. You want to allow them to have their comfort items. Maybe let them have their back to the wall or just not to a door for sure. Make sure they're physically comfortable and be kind, be patient, talk softly, understand that trauma can really make you someone who you weren't before. And it can make you feel like you want to feel better, you want to be happy, but you're so afraid of letting down your guard for one moment, that something terrible is going to happen if you let down your guard for one moment. And things might be fine right now, but then what if, feeling like something bad is going to happen. So you can really help. One way you can help is by creating an environment where they feel safe through the physical things we're talking about, through kindness, through patience, through offering not an overload of options, but easy win projects. Few decisions have to be made, but then that decision is honored. And they see that they can be successful, they can set boundaries, they can maybe you can slowly guide them through articulating what it is they want. And even if it's something simple like saying, no, I don't want to go, if you respect that, then that makes them feel more confident. Like, hey, I can say no, and no means no. So knowing whether the source of the trauma is past or present is huge. If they're in the process of dealing with something, it'd be a lot more gentle than if it was something in the past. Uh, be really clear about your scope of practice, though, because you're not there unless you are trained as a social worker or a therapist or a psychiatric nurse, for example. Don't take on that role and try to go deep into helping them resolve these issues. Be really clear about your practice. Also, your professional line. So remain professional and not go into this friendship mode. You want to encourage their sense of safety, their self-determination, and encourage hope over fear. Now, I'm going to skim through a couple of these because we can stay on time here. Give them easy wins, minimize the need to make decisions. So for special populations, again, of course, we can't cover everything, but broadly speaking, this might be folks with a combination of mental health issues and uh, substance use issues or disorders. And there's a huge range, of course. You might work with these folks in psychiatric units, mental health and addictions units. This might be unhoused folks. And I can tell you from past experience when I went through a period of being unhoused that it's not like everyone can be lumped into one category. Some people really want to get out of that situation, and other people they feel perhaps it all feels so big it's unsurmountable. And so what I want you to keep in mind with these folks is um, be compassionate, but also maintain your boundaries. As far as personal information, do protect your own personal information and try not to be prying about their personal information. Like I would suggest chat about light things like what kind of music do you like as a way to get to know them rather than tell me about your family. That might be a real triggering statement. It becomes quite important to keep yourself safe. And we're going to go on to the next slide here and talk about violence prevention. So if you're working in a facility, you might see, at least in Canada, you might see a purple dot on somebody's chart. And what that means is they have a history of violence, whether that's verbal aggression or physical aggression. So you want to be particularly aware of keeping yourself safe. Um, if there is an aggressive incident, and we'll talk more about how to keep yourself safe in a moment. So if there's a code white, that is an aggressive incident, a violent incident in progress, or someone is escalating to the point where it appears like it's becoming quite aggressive. And there's usually a trained team at different facilities to deal with that. So know what your facility policies and procedures are before you go in to see your clients of how to deal with a violent incident. And if you're an independent practitioner, I really recommend that you have a plan before you go take a group out into the woods, for example. What will you do if someone becomes violent or aggressive? I could carry your cell phone, call emergencies, etc. I'm going to double check here and see first, before I go on to de-escalation. So violence prevention, um, I recommend, um, if you know someone is purple dot, or you're working with special populations, or someone with advanced dementia, or you're getting to know someone, stay at least kicking distance back. That is a guideline. Watch out for if they're holding anything or have anything nearby that could be thrown, and don't wear something that can be grabbed, such as a necklace or big hoop earrings as a basic place to start. So we want to be aware of our stance. So the classic stance is 1 foot, feet shoulder width apart, 1 foot ahead of the other, hands kind of like this. And it looks like, it's just thoughtful. It doesn't look aggressive or threatening, but you can easily block or step back if you need to. Don't let yourself be trapped in a corner. Always be closer to the door, for example. Watch your tone, stay very calm. Really try to stay calm so that you don't respond to their escalation by triggering more. Keep your language professional, even if they are yelling and swearing. You could say that's inappropriate. That's not acceptable language. I'm going to leave and come back in a little while and you can go get support. So if someone is acting aggressive toward you, try to leave first thing, obviously, but you can try to talk them down and saying, I'm here to help you, but I need you to put that down. So after being part of an incident where you felt threatened, even if it's verbal, do report it and use the trauma support tools for yourself. Nurture yourself, write it down, debrief, talk to the nurses, talk to staff, do what you need to do to take care of yourself and make sure you report it because it needs to be charted and you might want to adjust your contractor policies to reduce your risk in the future, such as working in twos. That is a really common scenario when someone is purple dot or in special population units, always work in twos. So quickly, we're going to revisit our scenario from the beginning. So now, if you saw somebody sitting at a chair in a wheelchair with foot supports, and they were twitching a little bit as you approach them, what might you do? I personally, I might think maybe there's someone with Parkinson's and they are willing to be chatty and friendly with me. I just need to get to know them, or it might be someone a little bit more advanced in dementia who's kind of randomly picking at things and be easily startled. Um, I would, in either of those cases, I would probably sit on the opposite side of the table from them until I got to know them, giving them a little bit of space just to make sure that I'm safe, and then I would engage. So we looked at the 5 domains of health. We're going to use sensitivity and curiosity to get to know people. We're going to use our violence prevention techniques to keep ourselves safe, keeping a little distance. Watch out for those warning signs that someone might be getting triggered. Are they clenching their fists? Are they clenching their jaw? Are they staring at you? Are they using Words like, are they swearing at you? Those are all really good clues that someone might be starting to escalate and it's time to back off. We are going to also use infinite patience in approaching our people. Thank you so much. Thank you, everybody, for joining us today. I want to thank Florida Horticulture for Health Network and Sarah and Jessica and Leslie. Thank you all for coming today. I really appreciate it. Do we have any questions?
Nanette, thank you so much. We really, really appreciate this. That was incredibly informative. And even if you've worked with people of various populations before, the reminders are always like so nice. So thank you for presenting on so many great strategies and telling little stories throughout. I think it made it really wonderful. If folks have questions, we do have a couple minutes. It would be wonderful for you to put those in the chat and I can send them over to Nanette.
In the meantime, I'd like to mention I have a couple of blog series people might be interested in. Creative adaptation, those are a series of interviews of creatives with diverse abilities and how they overcome them. And then the Interconnect Journal is specifically about plants. And so all plant fans here, we're all plant people here. If you're interested in looking at some more research on the symbolism, lore, benefits, uses of a few plants, that series might be of interest.
Wonderful. It looks like we have a hand raised. Sonia, if you had a question, do you want to put it in the chat?
Hello, I don't know if I can type anything on the chat. It says who can record your messages. I just met Nanette at Claytree when she was a practicum student, and I work at Claytree as an activity worker. And I just wanted to, I saw this post on social media, and I just wanted to tune into this today. Oh,
Thank you so much, Sonia.
yeah, I finished my program at VIU not too long ago, and it was really, really insightful. I learned a lot about, you know, about creating different activities.
I really
Great.
appreciate that.
Thank you. Thanks for that comment. I'm not seeing other questions, so I'm going to stop the recording now.